Hello, my name is Felicia Davis. I am coming today because we're in the middle of annual enrollment period, and I wanted to feature today a Caresource plan, which is called My Care Ohio. It's a HMO, it's a dual plan. This is benefits for 2026, and it's for people who are on Medicare and Medicaid. Thank you for joining me. I'm going to try to keep this short so you can move on with your day. Thank you. Welcome for considering CareSource My Ohio. The goal today is to help share information you may need to make an informed decision about your healthcare choices. And the vision of CareSource is transforming lives through innovative health and life services. It's not just about making a change, it's about making a difference. Today, I will review just a little bit about Medicare eligibility, briefly on ABCDs of Medicare, accessing your care, and care source and the benefits, how to enroll, and what to expect once you have enrolled. Care source, and I will show you a couple other plans. I'm going to show you United Healthcare, briefly United Healthcare, and also I believe I have Melina's plan that I can pop up. And at the end, I will share my phone number. But anyway, CareSource is a nonprofit healthcare plan and a national leader in managed care. They have 30 years of history of serving varied population across multiple states. They are serving in Arkansas, Georgia, Indiana, Ohio. You can read, I won't go over all of them, but they're in these states serving over 2.1 million individuals. They have Medicaid and health insurance marketplace and dual plan. That's people who are on affordable care. They also have plans for that as well. Just a little bit about myself. I have been in the business for 20 years, experienced serving the Medicare population. I think I've served over thousands of individuals. My background, I've worked for United Healthcare for some time and Aetna, but I went on my own, so I run my own agency, still serving the population. And my mission is to help individuals. I know it's very challenging when you're faced with different companies coming at you all the time, especially during the annual enrollment period, which is October the 15th through December the 7th. So we need to look at our plans so we can make a change. But I know you're being bombarded with all this information. It can be confusing. And I'm here as a trusted agent that you can trust. I'm a licensed agent. I do not represent the government, Medicare and Medicaid. I may be compensated based on your enrollment. And I want you to know no obligation. And you can call me and you do not have to worry about enrolling my plan. You have a question, I will definitely be happy to answer your questions. Here's a brief overview of what Original Medicare, the A, B, and C's of Medicare, which is A, B, which is your hospital and medical insurance. You must have this to enroll in a Part D or Part C. Medicaid there's plans that you can be on Medicare and Medicaid, which is Slim B, Q, and D for dual eligibility. And Part C is a Medicare Advantage plan that you incorporate A, B, and C and D. Uh, the health plans incorporate all in one. Now, this is what's happening in the state of Ohio. They're changing the name. Instead of My Care Ohio, it's going to be the next generation of My Care Ohio. And there's some changes going on because the Ohio Department of Medicaid is making sure to upgrade current My Care programs. The goal is to deliver better personal centered experience for Ohioans across the state. Focus on improving individual and population wellness and healthcare outcomes. Who can join the next generation of My Care? have to be 25 and must be enrolled in a Medicaid care or Medicaid product and live in one of the 29 counties. And Trimble County is in Mahoney County. It is a county that my care is in. What are the benefits? One Ohio coordinator to help manage both Medicare and Medicaid. You'll get one call and only one organization will handle your care, which makes this simple. And over here, you'll see current My Care January 1st. These are the counties that will age in or phase in. To you see Trimble and Mahoney. You see Summit, Cuyahoga, Cleveland, Columbiana County, Geauga. And then the phase two, you'll see the Ashtabulars in April that will phase in to this new next generation My Care Ohio program rollout. I won't go any further about the dates before Ohio is set for January the 1st. Is the first phase. Let's talk about a few of the benefits. Ohio Caresource has $287 monthly rolled out over, and it includes over the counter utilities. You can use this card for any of these services, rent and mortgage assistance, healthy foods. Unused amount will roll over month to month and will expire at the end of the year. If you have special condition, you can qualify for a chronic claim. And here are some of the chronic conditions: cancer, diabetes, conditions with functional challenges. 22 conditions. My Care Resource, there is a rewards. If you get your annual physical, there's a reward program where every time you get one of these services, a flu shot, any of these services done, this money goes on this card. And if you don't use it, rewards will expire in 2 years from the date they are added to your card. Also, zero copay for your covered drugs. Zero copay for your medical benefits. I'm going through this list. I can go through everything. If you call me, I will go in more detail about these benefits and services. But your copay for the doctor, zero inpatient hospital care, emergency room, urgent care, preventative services, ambulance, you pay zero copay for that. Dental. This is the key to a healthy life, healthy way of living. Is your mouth. $5,000 towards any dental services you may need. And Delta Dental is the company that will, the insurance that will cover the dental plans. You have hearing services, 32 channels, 8 styles. True Hearing is the company. And levels, so you get two True Hearing advanced level hearing aids every 3 years. Limit one hearing aid per ear every 3 years. Rechargeable styles are available. You have vision. If you're between 21 and 59, one exam, one pair every 2 years. If you're between 60 and older, one exam and one pair per year. Fitness benefits. You could get a gym membership, home health benefits, workout plans. Oh my God, digital workout. This is awesome. It's called Cellular and Fit. Transportation, rides to where? Healthcare visits, community wellness services, gym, pharmacy, grocery store. How many trips? Unlimited. I've not seen that with any other company. I believe unlimited. Meals, 2 meals per day. I'm just briefly going through this. 2 meals per day, 14 days following each inpatient or skilled nursing facility. That's nice if you're at home and you don't have anyone to cook for you. And the role of your primary care physician, I'm your first contact to enroll in the plan. And then your primary care is the most important. CareSource encourages you to select a primary care provider that will coordinate all your healthcare needs, except for urgent and emergency and out of area dialysis. Because emergency, you just go to the nearest medical facility anywhere in the world, you're always covered. And if you want to enroll, you can call me, um, and I can get you enrolled. CareSource will process your application and confirm your eligibility. Medicare will confirm your enrollment. You'll receive a confirmation letter or call, and low income subsidy rider, if eligible, because there's a low income rider, if eligible. Receive, and I can get in detail with you if you give me a call. Receive your CareSource member ID card within a few weeks after you're enrolled. You'll get a new member kit in the mail. And during the first 90 days of enrollment, you will receive a call from a care coordinator. And this person is to help you fill out a health risk assessment. So they make sure that they can fit your needs and all the things and services you need to live a healthier life. Now, what to expect as a new CareSource member, as I state, number one, you will receive a welcome call from a representative. Number two, it will help you schedule an annual wellness visit with your in-network provider at no cost to you. And then you expect to hear from your care coordinator in the next 90 days. CareSource care coordination. The staff is trained to help you with any special medical problems like asthma, cancer, diabetes, or other medical conditions. As I stated, help you complete that health risk assessment so we know what your needs are. Find community resources, schedule provider appointments, answer any questions you may have about your plan benefits. Find an in-network specialist provider because you must use the network. Schedule transportation wise so you can get to your appointment and discuss medications. So you don't have to worry about all that getting on the phone and calling. You'll have one contact and they will make sure you're taken care of. Your personal online account, get the most of your member experience, select a PCP, request a new card. This is your personal online account. And this is the if you're already a member, mylife.caresource.com. And want to talk to someone instead, here is my number, 330-395-0200. Thank you for your time. And I wanted to show you, here's my local number again. I'm Felicia Davis. Here's my local number. And I also want to go through a few things with you real quick. I wanted to show you a couple plans. This is United Healthcare's dual plan. And it say you must have full Medicaid benefits if you want Ohio S2. If dual special needs, you have to have two MB. Who doesn't have full Medicare benefits but get all the Medicare cover services provided at zero cost? So look at this. If with this one, you get $256 a month over the counter, 102, 103, zero. Now, United Healthcare has a limit, 36 way trips, 24, 36. CareSource had unlimited vision, zero. We got a free membership. I wanted to show all your services here, zero, zero, zero. So most of the plans are very, very similar. This is Trimble and Mahoney County, and you'll see the other plans, Cuyahoga. Here's my phone number as well here. Here's Molina's. Here's Molina plan all the long in. So I have Molina up. Um, that was the plan. So here is If you're just on Medicare, here's a few plans for United Healthcare. I just wanted to show you a brief overview of some of the plans. $5,000 for the plan OH if you need it done. So every year you may have different needs. And if you wanted to do it yourself, here is where you would go. Sunfire Matrix. You could take a picture of this and you will, and I'll put a QR code at the end as well, where you can go right to it. But this here, you can put your zip code in, find your plan, find all the plans. So I showed you a brief overview of a few plans. You can skip the doctor, you can skip your prescriptions, but if you want to put all your medications in, you can, you don't have to. And it saves it and it pulls out all, when you put your doctors here, it'll show all the plans you man devoted. And you can go here and you can, there's 16 more plans devoted. You can compare. Here's how you compare the plans. Humana PPO, and here is the Aetna plan, and you can just click it and you can compare all these zero premium, and you can scroll through here and see the plan. Now the dual plan that I was telling you about, right here, the special needs plans where you get zero on over-the-counter benefits. Here's Aetna. I going to show you Aetna there. Here's Aetna. There's the chronic condition that if you have a chronic plan, and here's Humana. You just seeing who's all there. Here's the voter. It's a chronic kind of devoted. And anyway, if you have one of those chronic conditions, zero premium, but the devoted is 31. So that's where you can compare, you can play around and go through here. But I wanted to take time today to show you how you can get and how easy it is. Thank you for being with me and sharing your time. Here is the QR code for the Sunfire, or here's the email you can type in and go right there, get your phone out and take a picture. It'll take you right there. Here's a Medicare Clear Guide. Here's my phone number. Attention again, Medicare and Medicaid major changes are coming in 2026. So make sure you maximize your healthcare benefits and discover how to get the most from your Medicare benefits. And I can definitely assist you in that if you're still all confused. Thank you and have a wonderful day.